All right. Happy noon, everyone. My name is Jillian Graber, Executive Director of Protect PT. Welcome to our monthly Lunch and Learn. Today, we are talking with Kristina Marusic on the power of the written word. And we're going to be talking about Kristina's new book, which we're going to showcase here in a minute. But first, I wanted to introduce you a little bit to Kristina. Kristina Marusic is an author and award-winning journalist who covers environmental health and justice for environmental health news. She holds an MFA in nonfiction writing from the University of San Francisco, and her personal essays and reporting on topics ranging from the environment, LGBTQ plus, equality, politics, to feminism, food, and travel. She's been published by outlets including CNN, Slate Vice, Women's Health, and Washington Post, MTV News, The Advocate, Bustle, and many others. Kristina, we welcome her. She lives in Pittsburgh, and her and her partner of 10 years, Michael, and their really cute dog who was just barking in the background, Mochi. And I want to invite everybody to visit Kristina's website, KristinaMarusic.com. And Kristina, thank you so much for being here today.
Hi, Jillian. Thank you so much for having me.
Good to see you. It's been a while since we.
It's been a while. Yeah, great to see you again.
Yeah. So I want to just start out by talking a little bit about your new book, which is on the next slide, and that I have it right in front of me. We just got our copies last week. I also want to tell people right now that if you're watching this live, you can actually enter in a giveaway. So you can see the link up above in blue. You can enter if you do so while you're watching live by the end of the broadcast. So if you put in the form by the end of broadcast, you'll receive a free copy of Kristina's new book, A New War on Cancer, which we're going to be talking about today. We also have a really great event scheduled for later in June, and we're going to talk about that as well. And if you want to buy it, if you're not watching live and don't have a chance to enter the contest, or if you don't win the contest, you can also get the book for 20% off at the islandpress.org. So I just wanted to mention that for everybody. So please, I'll try to remind people throughout the broadcast today to go online for that giveaway. And then we can also pop it in the chat. We'll pop the link in the chat for y'all so you can see. And feel free to ask questions and put comments in the chat as we're talking to Kristina, so she has a good opportunity to, listen to some of those questions live and answer them live. And then this will be rebroadcast, and we'll be able to let you know when our next meeting with Kristina is. So if you miss your chance today, there will be another chance to ask questions later when we have our book event in June. Kristina, we went over your bio, but really I wanted to know, how you got involved in journalism and really specifically environmental journalism. So tell us a little bit about that.
Yeah, thank you, Jillian. I'm so happy to be here talking to Protect PT. I've reported on a lot of Protect PT's activities over the years, and so I'm always happy to get a chance to meet with you all. So I got my start in journalism around 2014, I guess almost 10 years ago now. And I initially, when I first started out, I was actually working for MTV News, which as of just a couple weeks ago, basically no longer exists, which is so sad. Someone who grew up loving MTV News. And I covered, I was on the team that was called, we reported on issues, which basically meant we were like the only serious beat. Everyone else was kind of on like, celebrity gossip and music videos. And then I was on this small team of like 4 or 5 people that reported on kind of serious news. And I very naturally, I reported really heavily on the Supreme Court's marriage equality decision when I first started there. But I also kind of became the go-to person on the team who was covering the environment. And so I wrote a lot of stories there about climate change and the impacts of pollution. Actually, one of my first stories that went like very viral at MTV News was about an Indian activist who like remade a Nicki Minaj song to be about pollution caused by a mercury plant, or I think it was a medical supplies facility in her community that poisoned the community with mercury. And it was like this really powerful activist song. So after MTV, I freelanced for several years, and these are a couple of my stories that are on the screen here. I ended up doing some investigative reporting for Public Source, which is a Pittsburgh area outlet. Both of these projects, in particular the one about how schools aren't required to test for lead and radon, were really big undertakings. That one in particular took about 6 months, and I filed right to know requests, and I ended up with like, I went around to the 12 largest school districts in the region, and a lot of them only had paper files. So I ended up with like boxes and boxes of files in my home from these school districts about when, if ever, they had tested for lead, radon, mold, any other kind of environmental hazards in school buildings. And I learned through the course of that investigation that for the most part, they were not doing that, or if they did, and they found problems, they weren't reporting to parents or they hadn't remediated. And so the investigation uncovered lots of problems. I realized doing that project taught me two things. One, that I really like doing investigative work. I found it really like engaging and exciting and rewarding. And two, that it was not sustainable to do it as a freelancer. I did the math after 6 months of work on that, and I was like, oh, I get paid 40 cents an hour for this? It just was not sustainable to do something like that involved as a freelancer. But it was really satisfying because it ultimately it led to a lot of outcry and ultimately prompted some new policies, and along with other reporting and work by advocates, prompted some state level legislation related to testing for lead and radon. So I found that really satisfying, and I knew I wanted to do more investigative work, and I knew I was interested in investigative work related to the environment. So in 2018, a couple of friends sent me the job post for Environmental Health News was looking for a Pittsburgh reporter, and they were doing like a big national search, but I lived in Pittsburgh already, and the editor there eventually reached out and also encouraged me to apply. And so I've been doing investigative reporting focused on Pittsburgh and Western Pennsylvania and the environment for the last 5 years or so.
I'm going to make this window a little smaller so people can see the whole slide. Yeah, that sounds really, really interesting. And so I guess my first question is then, how do you stay informed about like the latest developments and in scientific research and in the environment and on environmental issues in general? Because I mean, there are so many environmental issues here in Pittsburgh. It's like, there's so much to report on.
Yeah, there's so much going on. And thank you. That's a great question. So I try to stay really engaged with the community. I try to go out to community events and watch webinars and kind of stay up to date, get newsletters from organizations like Protect PT to know what people are concerned about in the community, what people are up to. I also have a lot of Google keyword alerts and Google Scholar alerts. So I, review notifications about new research related to things like air pollution and fracking and lead contamination. And I get Google News alerts about things like air pollution in Pittsburgh and sewage overflows in Pittsburgh and Western Pennsylvania, and the health of the Monongahela and the health of the Allegheny River. So that's like lots of ways to try and kind of stay in the know about what's happening. But then I also really benefit from being at an organization that was founded by a scientist and has a scientific arm. So Environmental Health Sciences publishes environmental health news, and we have there are a team of scientists who are also on staff, and we periodically meet, and the scientists talk about what's new in their world, which can be really informative for my reporting. And vice versa. So we try to make sure they know what we're reporting on, what we're thinking about, and we try to be, collaborative in that way. And so some of these stories, Breathless was the first investigative series I did for Environmental Health News about Pittsburgh, and I spoke with researcher here, Dr. Deborah Gentile, who's also a pediatrician, and she had done some really groundbreaking studies on asthma and pollution in the Pittsburgh region. So I think it's it's a real kind of combination of science and activism, and trying to stay up to date about what's happening in both those worlds, and then see where there's overlap and where those things can be in conversation with each other.
Yeah, and I was like, so the first time I met you was when you were doing a health study, and I thought it was really cool. I had never seen a reporter do that kind of health study before. So, do you mind talking a little bit about that process, and kind of and I'm going to try to find the link here so we can put it up for people in case they haven't seen it. But I mean, a lot of people have seen it, right?
Yeah, I think it's just, I'll drop it in the, oops. I think it's just ehn.org/fractured is the link to that series. So Jillian and her family participated in a study I did looking at whether fracking chemicals are getting into the bodies of families who live near fracking wells. And really the only reason I was able to undertake something like that as a reporter who does not have a background in science was because I have access to so many scientific researchers. Our executive director, Douglas Fisher, has a background in reporting, and he did a similar investigation in the Bay Area, I guess about 20 years ago now, where he tested families living in the Bay Area for flame retardant chemicals in their bodies. And his reporting prompted lots of outcry. Similarly, they found kind of shockingly high levels of these chemicals in people's bodies, and contributed to California changing its regulations related to flame retardant chemicals in furniture. Basically, they had this old law that required all furniture sold in the state to have these chemicals. Then scientists found out these chemicals are really harmful to people. And then, there was this reporting from Douglas, and a bunch of other researchers also did their own projects. And California ended up changing state laws. So he said, why don't we do that to look at fracking chemicals? And we looked around and we realized that there were only a really small handful. We could only find 3 studies that had ever tried to do something like this, and none of them had included children. So we really wanted to make sure to include children in our investigation. So it took about 2 years. It was a really long project, as Jillian knows. She and her family participated, and then also it happened, I started in 2019, and then we were in the pandemic, which further slowed everything down. But over the summer of 2019, I collected, I think it's a total of 69 urine samples from 5 families in Western Pennsylvania, some who lived much closer to fracking wells, and then some who lived further away, including Jillian and her family. And I worked with scientists at the University of Missouri who had developed this unique methodology to screen for a list of about 40 chemicals that are commonly emitted from fracking wells and their metabolites. And so we were able to compare what was in the air samples we took, what was in tap water, and what was in people's bodies. And the results were pretty striking. So we did find that many of the kids in our study who lived near fracking wells had much higher levels of metabolites for exposure to a lot of these chemicals than the national average. And yeah, that was an instance where I relied really heavily on our scientists on the team. And then beyond that, there's a page in the reporting that's like an about our data page, and it
Mhm.
has a long list of thank yous to all the researchers I consulted with throughout that project, and it's like 45 people or something. It's a very long list. So I talked to a lot of people with more expertise than me to make sure that I was getting it right.
Yeah, yeah. I just remember it thinking it did take such a long time, but just the fact that it was so thorough, like that's one thing that I thought was really great about it, and I guess the result of that is this like really amazing series that you were able to do. The funny thing is on the front page of this article, my son is there. He's going to be 15 now, so I mean
Wow.
they're like so little. I remember when this was done, they were so little. But I love how you broke it down into different pieces, so people are not overwhelmed by all of the ties and there's this is such these are like really complex subjects that I think that people maybe just either getting into learning about environmental pollution or getting into learning about environmental health. Maybe they're on the face of it, they think, oh, well, the environment, health, us as humans, like it makes sense, but it's such a complex issue. And so have you found that like I know you mentioned the right to know request and digging through records, which I've been there. It stinks. It's a lot of time, right? It's a real time suck. But have you found that that it's is it hard for you as a journalist to really put it into a story and describe the complex nature of these issues?
Yeah, that's definitely kind of the big challenge of the job. And I try to really balance, I talked a lot about the kind of science and the data from that story, but in the reporting, the stories of the families involved are really central. I really tried to put those at the forefront. I spent a ton of time with your family and all the other families in the study, and I came to really care about all of the people who were willing to give their time and participate in that. And so I wanted to make sure that I centered the humans that are the whole reason for the research, right? So there's a lot of data in there, but I really try to kind of put the people first and their stories first. And I hope that comes through in that reporting. And I do think, a big part of this job in general, I kind of think of it almost as being a translator. So I talk to researchers about these really dense, complex topics, and I ask every question I can think of and come up with what I think is an understanding. And then I try to translate what they've told me into really simple, accessible language that anybody can understand. And then oftentimes another part of that is then running that back by the researcher to say, hey, did I get this right? Did I oversimplify? Did I too much? Did I miss anything critical? And just making sure that I'm, doing justice to these very complex topics. And there's, one thing I've learned doing this job is that one of the reasons researchers use jargon is because scientists are trained to use really specific language that means really specific things. And so sometimes if you're using a synonym, it's just not quite right, or it doesn't exactly capture the very technical thing they're referring to. And so I think it's a lot of work to if it feels appropriate to use that kind of language to really break it down and say, this is what this means, this is what this is referring to, this is why we're going to use this word when we talk about this.
Yeah, and I think it's so needed. I think this is something that, like, in our work with the education that we do, it's like we need to kind of break it down for folks because not everybody's going to understand. And I think that's one of the things that I love about your reporting, and is that you can understand it, even though it is, coming from the science background, and it can be really intimidating as, someone, coming to this issue for the first time to be able to see that. And also, one of the issues that you report on is like, the mental health effects of pollution, which I know a lot of people don't report on and a lot of people don't think about that. But could you tell me a little bit about what really inspired you to report on the mental health impacts of pollution?
Yeah, so I came across a study a couple years ago that found like a pretty compelling link between exposure to air pollution and um, mental illness. And it one of the things I was kind of shocked to learn about was that um, there's this thinking that exposure to air pollution can actually cause like physical changes in our brains that can worsen our mental health. And that was really shocking to me. I think in working with communities exposed to lots of air pollution and living somewhere with lots of air pollution, I certainly had heard people talk about, like the mental health impacts of climate change or of being worried about pollution, right? That we can have increased anxiety about our health related to those things. But I had never before heard that like being exposed to air pollution could actually make us have worse mental health in a physical mechanism kind of way. So I found that really compelling. And I ended up partnering with a reporter at the Allegheny Front, Julie Grant, who's an excellent reporter, to do a series called Pollution's Mental Toll. I think we did that man, the pandemic years all just blur together. I think it might have been 2021. It was in the last couple of years. And it's a 5-part series that looks at the mental health impacts of air pollution, water contamination, and climate change. And I talked with some of the researchers doing that work on the physical changes that can result from exposure to air pollution, in addition to talking with therapists who have tips for dealing with climate anxiety, for example. And one kind of, I think, informs what we need to do at a systemic level, a policy level, a population-wide level to reduce our exposure to air pollution in order to reduce mental illness in our communities. And the other is really kind of more about how individuals can care for themselves around these things. And on that front, I think maybe the most important thing that I heard again and again is the best thing you can do is to get involved, right? Find some way to connect with other people in your community and take action in a way that feels empowering and like it is helping drive positive change.
Yeah, and I also think we should acknowledge here that there sometimes are multi generations that are being impacted by air pollution. Particularly in environmental justice communities, we see this, and and there have been different stories on. Environmental justice communities and being exposed to air pollution in particular. Um, and um, and so do you have like specific examples of communities or individuals that maybe have taken action to combat pollution and its effect on their mental health?
Yeah, so you know, I think that a lot of times, so in that reporting specifically, Julie spoke with a number of climate advocacy groups and a number of therapists specifically focused on climate anxiety about, the ways that like getting involved can help people have better mental health related to those things. And I spoke with the researchers who were really focused on kind of the science of pollution in our brains and how it impacts our mental health. And lead, of course, was a big part of that when you think about cognitive health and neurodevelopmental health and also mental health. Lead contamination continues to be a big problem in Pittsburgh. And so, not directly, one of the activists I talked with for that series is Melanie Mead, who lives in Clairton, about 20 miles south of Pittsburgh. And Clairton is home to the Clairton Coke Works, so has regularly sees some of the most polluted air in the United States as a result of their violations of clean air laws. And Melanie talked about, the kind of difficulty. She talked about her own mental health struggles and how part of that is feeling like alone when she can't get other people in the community to like join her in her fight for clean air in her community. But since then, Melanie, has been really persistent and dogged in her activism in Clairton. And just in the last year, U.S. Steel shut down the 3 dirtiest coke batteries at the plant. And that was in part because of community advocacy from people like Melanie, and the Allegheny County Health Department stepping up enforcement, again, because of pressure from community advocates. And certainly that, there's 2 prongs there again, where she feels encouraged and more optimistic as a result of those changes. And then the community also it's not going to entirely solve the problems in Clairton, but it is expected to reduce the problems with air pollution that Clairton has and the broader region has as a result of that plant. And so it's also, in the long term, going to improve mental health for the region. So I think I think there's a lot of reason to focus on the solutions parts of that reporting, in addition to being like, oh my gosh, and worried about the problems that I covered.
Yeah. Yeah. And so, like, as you can see on the screen, like, there's a wide variety of topics that are, like we said, it's a complex issue, right? And so, tell me a little bit about your reporting on PFAS in Pennsylvania. This article in the middle, that's something that we talk about a lot with as it pertains to fracking. So it was that like one of the areas that you centered around, or were there other areas that you were looking at for PFAS chemicals?
Yeah, this initial investigation that's the kind of middle block here was a collaboration with Public Source, and kind of broadly covered the issue of PFAS contamination and PFAS regulation in drinking water in Pennsylvania, and then at the local level. So we investigated contamination near the Pittsburgh International Airport and near local military bases. Those are 2 places that military bases and airports have used this firefighting foam that often contains PFAS in drills and training for years and years. And so the groundwater and drinking water surrounding those types of facilities is often contaminated. And we found that did, in fact, happen in Pittsburgh. So most of this reporting was kind of generally focused on, what are PFAS, what are the problems we have with them in Pennsylvania. I also did a piece for that story that was really interesting and that has seen some potential legislative fallout about how the use of biosolids, it's basically cleaned up sewage sludge that gets decontaminated, spread on farm fields throughout Pennsylvania, can cause PFAS contamination of food from Pennsylvania farms. And that's true. So organic farms aren't allowed to use that stuff, but PFAS are also called forever chemicals. And so once they're in the soil, they're in there forever, essentially. So if 20 or 30 years ago, an organic farm was a conventional farm where biosolids were used, it's possible even for these things to show up in organic produce. And at the time when I was writing that story, I asked the Pennsylvania Department of Environmental Protection and the Pennsylvania, I'm not going to remember, Farm Workers Association, Farm Bureau, I don't remember the exact name of the organization, but the statewide kind of advocacy group representing farm workers, if this issue was on their radar, and both said no. They hadn't heard about this. And then a couple of years later, it hasn't been passed, but at the state level, legislation was proposed to test all biosolids in Pennsylvania for PFAS before they could be used on farm fields, which is something that lots of other states have already done and moved forward on. And then more recently, you asked about oil and gas. Last summer, I did a series of follow-up stories reporting on the use of PFAS specifically by the oil and gas industry in Pennsylvania. I developed a map that lists all the known places where PFAS have been used in oil and gas wells. And then I worked with Frac Tracker to develop a map that shows where waste from all of those sites. There's only eight sites where it was listed in fracking companies' public chemical disclosures that they used PFAS. That's likely an undercount because there's lots of loopholes that allow companies not to provide a full list of chemicals. There's 8 wells where we know because companies disclose that they use these chemicals. And I worked with Frac Tracker to track where waste from all of those facilities went, and it's hundreds of facilities across multiple states. And the experts I spoke with said, all of those sites could be contaminated with PFAS as a result of this. So it is potentially a huge problem in Pennsylvania. I also wrote about one of the people who participated in my initial fracking study that Jillian was in, Brian Latkinich. Researchers found a bunch of PFAS in his tap water that may have come from the fracking wells that used to be on his property about 400 feet from his home. And I spoke with a bunch of experts who said, as far as they know, that's the only case of residential tap water being contaminated with PFAS that might have come from the fracking industry. So there are a lot of unknowns in that issue because there's this big lack of transparency in the industry, but certainly worth paying attention to as a potential source of PFAS contamination in our communities.
Yeah, and I think that that's what we come up against a lot is like, how do you prove that this particular site caused contamination of water or PFAS contamination if there's no way to track it, if there's no disclosure of those, if those chemicals are used. And I think that even the fracking industry itself, some of the drillers don't even know what's in the cocktails that they use. We're trying to get some of that information right now on a couple wells that are near here, and we just cannot get a straight answer as far as like what these chemicals actually are and if they contain PFAS or not, because even the fracking industry doesn't know. And I think that goes to a larger issue about these types of practices in our communities where there's very little information given to the people that live there. And I think it's particularly harmful to folks that have well water, folks that are not hooked up to city water, because that well water, it's very easy for it to get contaminated from fracking. But I will say, even like they're fracking around Beaver Run Reservoir, which is where Westmoreland County gets their water. So like, I often wonder, is there PFAS? Are they testing for that at the water authority? They're letting fracking happen at the water authority all the time. And I was on one call with a DEP official here in Pittsburgh, and I was shocked to hear him say the solution to pollution is dilution. I'd heard that before, but I was just like really shocked to hear him say it. And this was with a PFAS issue. This was on a separate issue, but actually, and I think that this was reported on, and I can't remember who reported on this, but they the Westmoreland Sanitary Landfill, which, as you may know, accepts fracking waste, and many landfills accept fracking waste, solid waste, and actually also the sludges and things. They can actually, if they're not completely solid, they can solidify them using different materials, and that's in a document called I think it's called OG-17. It's their waste management plan, and they can actually solidify some of those like more or less solid wastes, and then put them in the landfill too. So they can solidify those and put them in the landfill. And in Westmoreland County with the Westmoreland Sanitary Landfill, they had a leak of leachate. And one of our partner organizations, Three Rivers Waterkeeper, went out and tested the water there at Spears Run after that leachate leak happened, and sure enough, they found PFAS there.
Wow.
And so like it's in our landfill. So I think what it does, Kristina, is it actually brings up a larger issue as to where the waste is going from all these places. I think
Mhm.
reports like yours and like work like Frac Trackers on like showing where all that is really important work, because like I think it illustrates that even if you don't live next to a fracking site, you still could be exposed to fracking chemicals. And
Mhm.
that's one thing that actually shocked me about the work that you did with the fractured, because like you picked me and another family because we were at least 5 miles away from a fracking site. But if I remember correctly, there were really high chemicals, certain chemicals found in my daughter, that were not have found in my son. You know, and I
Mhm.
told you at the time that I thought that my hunch, like as a mom, my hunch was that it was like the milk, because she was the difference between these two children and things that they experience is that one drinks milk, and I'm talking organic milk, one drinks milk and one does not. And you think,
Mhm.
okay, the food that you give your kids, like maybe it's organic food from an organic farm, or the organic milk that you're feeding your kids, you think that it's supposed to be safe because it's organic, but maybe it's
Mhm.
not. And maybe that, these fracking chemicals and other chemicals that are, really being used by where they make our food, where they,
Yeah.
where the milk, where the cows are grazing, this is getting into our food supply. So, so I think it just exposes a larger issue, a larger environmental issue, that even if you don't live around one of these sites, you still could be exposed to these chemicals.
Yeah, absolutely. And you said something, you said it seems like operators don't even know what's in the chemical mixtures they're using in fracking. And one thing I learned while reporting that series on the oil and gas industry's use of PFAS in Pennsylvania that really shocked me was that um, that's true. Operators often don't get a complete list of chemicals from the companies like Halliburton that provide these mixtures. They're called things like, they have names like Frack Magic, and they may not get a complete list of ingredients from operators. Operators may not even keep a complete list of ingredients on file. They don't. There are very few requirements related to that. And Pennsylvania specifically has wording in our state legislation regulating these chemicals and disclosure of these chemicals that says if an operator doesn't provide a complete list of chemicals because they don't know the complete list, they can't be held liable for any damages resulting from those chemicals or for not disclosing. And it goes one step further and says operators can't be held liable for not disclosing a complete list of these ingredients, which is, I spoke with the researchers at Physicians for a Healthy Environment. I'm sorry, Physicians for Social Responsibility, that did the kind of initial reports finding that oil and gas industry was using PFAS. And they were saying that's really unique for Pennsylvania, that we waive liability not only for the producers but also for the manufacturers of these mixtures for if they are unable to provide complete lists of these ingredients. And it really incentivizes not it really incentivizes not being transparent, right? It incentivizes because if you can be held liable once you list the disclosures and you can't be held liable if you don't, why would you? Why would
Mhm.
you publicly disclose the chemicals you're using? So
Yeah.
the the way we regulate fracking chemicals in Pennsylvania is very problematic.
Yeah, yeah. Well, and that I think that like people ask me all the time, well, why don't we just ban fracking in Pennsylvania? And how did they ban fracking in New York and Maryland? And one of the ways that they actually banned fracking in Maryland was by looking at the liability and making and holding operators accountable for that liability. And they would have to get so much liability insurance, and they would be held liable. And at the end of the day, none of the industry people wanted to do that. So then the state was like, well, that's our hard line. Like, that's where we draw the line. And so if you're not going to do it, then we're just going to ban it. And they did. And they were really successful. Okay. And I have to say, like, with a bipartisan, support with a Republican governor. So, I just think that it shows that if you're putting the health of people first, and if you're putting the transparency to the forefront of what is going on in your community, then it just makes sense to regulate this in a way that people understand the risks. And I think that that's one thing that I think is most important about your reporting, is that you're uncovering all of this information that people need to know about, and then, like you said before, translating it in a way that people can understand, that the everyday person can understand these really complex scientific topics. But can you tell me, like, what is particularly challenging, maybe a story that you uncovered that was particularly challenging, and how did you approach that story?
That's a good question.
Seems like there's lots of challenges, right?
Yeah, so actually that PFAS and oil and gas story is a great example of a lot of times I'm trying to find information because I want to report on an issue that it turns out just doesn't exist in a publicly accessible way. So I have learned in the course of doing this job that then becomes part of the reporting, right? Like, if I can't find out all the places PFAS were used in oil and gas wells in Pennsylvania because of this lack of transparency throughout the supply chain and laws that incentivize keeping things secret or withholding lists of ingredients, then instead of saying, well, I've hit a wall and I guess I can't do this reporting, I think it's really important to let people know, the public deserves access to this information, and here are the barriers to us having this information. And then I'm also trying to, one challenge in this work has been finding ways to focus on solutions and trying to make readers feel, instead of just feeling like despair and misery, feel empowered to take action and push for meaningful changes. And so I think that's also something that I try to do in all of my reporting now, is say, these are the problems, these are the structural and systemic factors that have created these problems, and here are some ways we can try to change those, and here are some resources for getting involved. And so that's definitely been a challenge, because a lot of this is bad news, and it feels really important to my mental health, and then also really like an important thing to provide readers with, not just here are the problems, but also here are the available solutions and how we can push for them.
Yeah, I think that's super important. I mean, we run up against this problem all the time. When you go somewhere and you tell them, you tell folks like, "Hey, fracking is going to happen in your community," and here's all the problems with that. Sometimes, I've actually had people yell at me, like, "What do we do?" And I'm like,
Yeah.
"Hey, there are things that we can do. Like, we can take this power back, right? Like, where it's like power is being taken away from us, and away from our community, and away from our family. But there's ways to take that power back, and I think that's a really important, really important thing and I'm so happy that that's the way you approach these situations. Tell me a little bit about the story that's on the screen, because I was actually at this event. Like, this was a couple of years ago. I was at this event.
So this photo is from a story that I did earlier, a couple years before this guide came out, and it was about the kind of contrast between um, uh, Native American tribes advocating for clean water and protesting fracking, and this huge fracking convention that was in town that I believe Donald Trump came to at the time.
Yes, yes,
Big oil and gas convention. Yeah, yeah. So this was outside of the convention center during that protest. It was a really powerful protest, and I thought it kind of encapsulated the kind of battle for environmental health in Western Pennsylvania. And so was this last year? I think that was 2022, or maybe even earlier this year. I wanted to put together a kind of like a comprehensive guide to what are the issues impacting environmental health in the Pittsburgh region. And Environmental Health News has a number of these guides that are really helpful. We have one on PFAS that just kind of details everything scientists know about PFAS. We have a similar one on BPA. We have one on environmental justice. What is environmental justice? What is the history of the movement? How is it relevant today? We have one on I think we're working on one on endocrine disrupting chemicals, and I think we have one on petrochemicals and plastics. And so I wanted to add to that something that kind of quickly summed up the challenges that we face in Western Pennsylvania. And so it's a dense it's a dense piece of reporting, but it's structured kind of like a listicle. So hopefully it's like easy to kind of quickly see, this is what our challenges are related to air pollution. This is what our challenges are related to water contamination. Here are the available solutions and who's advocating for them and how to get involved. So this links to a lot of my other reporting, but is a more kind of, it's not tied to a specific news event. It's more of a evergreen guide to what our challenges are in Western Pennsylvania and how to get involved, that I plan to update on a regular basis.
And so that sounds like it would be super helpful. Kristina, would you mind sticking the link in the chat so people know how to get to that resource, because that seems like a super important resource. And then we'll go ahead and post the link in the chat for the broadcast. I do also want to note we are giving away one of Kristina's books, and actually we're going to be having a book discussion that we want to invite you to next month. But this is her new book, A New War on Cancer, that just came out, and we're giving away one of these books. So there are a couple people that are watching live. If you are watching live, you can fill out our form. I just popped the link in the chat. That is the giveaway. And so if you are interested and you have to sign up on the form before the end of this lunch hour. So you got about 15 more minutes to sign up for that and to get that resource. And then Kristina, thank you for popping this link in the chat. I'm going to go ahead and put it into the chat here. I also linked, you did a great story on the work that Protect PT is doing, and thank you so much for that. That was May of last year, so like a year ago. We were hosting a local discussion on environmental pollution from fracking, and it was at our new environmental education center, and that was a really great story. And actually there's a picture of a well behind me, and they're currently, just want to let people know, they're currently fracking and drilling new wells at that spot. And then that's been a big problem because, like I said, there was like waste that was dumped on the road accidentally from that spot, and just a lot of problems with this spot. And so it's really important that folks know about that. And Kristina's reporting has been critical to helping people understand. Let me ask you though, how do you handle criticism or pushback from readers or sources about your reporting? How do you deal with that?
So occasionally there is criticism or pushback from the industry. So when I wrote Fractured, that all actually happened before the series came out. When I reached out to the industry and some of the trade organizations that represent the industry, they really kind of tried to like bully me or intimidate me into my feeling was into not running the stories, which I generally disregarded. I certainly, it doesn't feel good, right? It's unpleasant to have like confrontational conversations, and it was unpleasant, and it was something that I shared with my team at work, just so everyone was in the loop. But then once the stories came out, I think because we were so meticulous about like the data and being really clear about the science and being really clear with the caveats and what our study found and what it didn't, we didn't hear much actually once the series came out, which was nice, felt good. I don't often get criticism from, I guess occasionally there are like Twitter trolls or people on social media, who will kind of want to fight. And I generally, if someone wants to engage in like a real conversation or has real questions, I'm always happy to do that. But generally, I just don't really engage with people who are clearly like antagonizing me on social media. I've never seen that go well. And in the past, when I've engaged with them, it's not, social media is not a good forum for like thoughtful, meaningful conversation. So generally, I ignore it. Occasionally, when there have been questions about, if there's pushback about like a specific statistic or data point, I will engage with that and clarify or ask for support from work to do that through like, sometimes I don't want to do that through like my personal Twitter account, but we'll do that through the Environmental Health News account. So, it's and just a very like measured response saying, actually, here's where we got this data, or here's the scientist who said it, or, just always trying to respond with kindness, but make sure that the facts are kind of at the forefront. And then I think in terms of, dealing with that personally, I just try to make sure that I feel good about the integrity of my reporting. I think that as long as I feel like I'm, telling stories that matter and doing the best job I can to convey the science accurately and clearly, then it helps me be kind of unbothered when people criticize. I think because, generally I don't, as long as I'm doing those things, it doesn't feel like those criticisms are valid, or I try not to receive it as like a personal attack.
Yeah, and I think that that's a problem that I think that unfortunately media folks have had to deal with recently, the kind of the questioning of the material that they present. But I do find that like even with our work, if I just present it in a factual way, which it sounds like I don't think people realize how much effort and how much double checking and fact checking and check it again, check it again, check it again that you do in your work, that it just takes a lot of time and effort. And so it is reliable information and reliable news. I think that if people want a news source that gives them that reliable, factual data and information, that yours is one to point to that would give them that. So, but I think you're right. Like engaging on social media can be really, really tough. I actually had a conversation with somebody on social media before we put out a post about, some upcoming thing that we were doing, and we're like, by the way, like this is happening in our community, and somebody came back with, well, they should let it happen, and we're you're against all this and everything, and just really didn't have a lot of just attacking us personally or me personally, and my one of my friends always says, like, if somebody is attacking you personally, then they don't have anything factual to say back or respond to. And so I thought about that, and I just said, well, these operators that we're talking about have not been doing a good job of adhering to the law. Like, the law is written for them and in a certain way. And as I think you talked about earlier, like the law is somewhat, in many cases, on their side, and not on the side of the community. And they were like, how do you know that they're breaking the law? And I was like, here's the link to the DEP website that shows all their violations. And they were like, oh. And
Yeah.
so
Sometimes it's actually really powerful to engage and just be really neutral and be like, oh, maybe you haven't seen these facts, so here they are.
Yeah, and that's what I love about your reporting, particularly when you use like really great resources like Fact Tracker. Like you can see the visuals, and I think that's awesome. This is one of the things you did on the mental health impacts from oil and gas pollution. We're just going to go through a couple slides because we're behind on the slides. We've been talking and having a great conversation. I haven't been telling Corey to move the slides along. So, and you said this is like a view from Clarendon Cookworks and Clarendon, PA. Yeah, and this was what you were talking about before about how this air pollution is altering the chemicals in our brain and leading to mental illness risks. But tell me a little bit about the next slide. Tell me a little bit about this slide.
Yeah, this was part of the. Before I do that, I'll just mention that for this series in particular, Pollution's Mental Toll, and for Fractured, there are videos that go with that reporting. And so the pieces are long and they're these multi-part series, but if you're short on time, there are these really good YouTube videos embedded where you can kind of quickly get a sense of the story. So I really wanted to find some local data for this story. Most of the research I was covering that talked about the ways that air pollution and water contamination impact our mental health took place elsewhere. And so they were demonstrations that the phenomenon exists, but they weren't Pittsburgh specific. And so I was trying to find ways to look into, is this happening here? Is this something we need to be worried about here? And so this chart on the left, the red line there is the median level of estimated daily particulate matter exposure that led to increased mental health emergency room visits for kids. That study took place, I think it's out of Boston. And it was basically every health system in the county was participated in this. And they saw a substantial increase in emergency room visits for kids having mental health crises after spikes in air pollution. And it's worth noting that all of the spikes they saw in that study were below legal limits. So they were increases, but they weren't violations of the law. And so I looked at our daily particulate matter exposure in 2020 that we had data for at one of the air monitors in Allegheny County. The Liberty Air Monitor is near Clairton, so it tends to have our worst air pollution in the region. And I put that line on that shows the level at which that Boston study saw an influx in emergency room visits to show just how often and how substantially our air pollution levels are well above that level.
Wow.
And I think it's really striking visually, right, to see just how often we have spikes that are well above that level. And then the chart on the right is data I was able to pull from the Pennsylvania Department of Health website. Actually, yeah, Pennsylvania Department of Health website has a lot of statistics on mental health. And I was able to look at Allegheny County and compare it with some of the state averages. And this just shows the number of poor mental health days by age in the county. And so 53% of 18 to 44-year-olds in the county had more than 50 days that they identified as having poor mental health for this year, which I also thought was striking. And then I was able to pull some more specific neighborhood data in that story too, and look at, I think Clairton had like higher than state and national average rates for some mental health indicators. And then of course they had substantially worse air pollution. So this was how I tried to include some local data in a story about research that didn't take place in Pittsburgh, and also with the hopes of saying researchers who look at these issues, Pittsburgh is a great place to look, right? We need more of these studies that look at these issues at the local level. And also, I think sometimes scientists get criticized by activists who are always saying more studies, more studies, more studies. And someone recently said something to me that I thought was really powerful. And they were like, sometimes we have enough data and we just need interventions. So I think also presenting this local data as a reason to say, like, yeah, this area is like ripe for this kind of study, but also we could really use some interventions here to protect people's mental health.
Yeah, and you know what? I think that's really important. And so the Environmental Health Project. So they help us with air monitoring. We have an air monitoring program, and that's something that their director Allison Steele says all the time. Like, we have enough data. They have been involved in getting the word out about this pit study that's happening around fracking. And it's like, well, we don't need to wait for the study results to tell us that people are getting sick. And this is your reporting is a good example of this. The Fractured series. If anybody knows this series, this is part of the Fractured series. And if you actually scroll to the next slide, so that's one of that on the right. That's Kristina in my living room. And then if you go to the next slide, you can see how she was. Oh, yep, there you go. So there were air monitors that we had to wear, which was really interesting. My kids thought it was kind of cool because they got to wear an air monitor, and we went around the neighborhood, and that's actually my daughter. I think she was getting her monitor installed that day, but that's Kristina installing the air monitor on her person because it was like taped to us, so when we were out and about, it was like at the level where we were breathing, which I thought was really interesting. And I like the way that the study was developed, and the approach to the study I thought was really, really important. We only have, we're at 1:00 right now. So I just wanted to ask, before we're done here, if you wouldn't mind, Corey, going to the next slide. How is writing a book different from, the previous work that you did? Can you tell me a little bit about that?
Yeah, so I really wanted the book. I talked about the importance of reporting on solutions, and I really wanted the book to be solutions focused. So, certainly it's different kind of logistically working on a book length project rather than an article. But I also really tried to make sure that my book, people come away from reading this book feeling empowered and excited to get involved and ready to do something instead of kind of overwhelmed and in despair. So the book is certainly outlines the problem of being exposed to cancer-causing chemicals in our everyday lives, but it's really focused on profiles of people who are leading the charge to change that and how the rest of us can support their work and help get that done. So it was really satisfying to write in that way because I was learning these incredible stories of people whose work is just really inspiring and gives me a lot of hope.
That's awesome. Yeah, and it sounds like from your perspective, like that's one of the things that is a way for us to get the word out about these things, to tell people's stories, and I totally agree. It's a great way to illustrate what's happening in people's neighborhoods. And just want to invite everybody here that's here today. We're going to have a discussion with Kristina about her book. So please get it ahead of time. You have almost a whole month to read the book, to get the book and read it. If you're on live right now, you still have one more minute to go online and to fill out that form, the bit.ly, to get a free copy. But you can also get it from the publishing company. It's also available on Amazon as well, and local bookstores, I believe, also have it, right, Kristina? What local bookstores could people go to?
White Whale in Pittsburgh has it. So does Riverstone Books, and not a local bookstore, but Barnes and Noble will have it too.
Awesome. Yeah. So pick it up and join us for our discussion on June 28th. It's going to be a really awesome discussion. There's also, if you get it from Island Press, there's a 20% off code. And I'm going to go ahead and put that in the chat again. Thank you, Chelsea, for reminding me about that. And you can sign up to be a part of the discussion at protectpt.info/war on cancer. So please join us and Kristina, later next month to talk about the book and talk about some of the wonderful stories that she wrote about. And if we go to the next slide, Kristina, I want to thank you so much for spending some time with us today, and really just also for the work that you do. It's really, I know that when I think I called you maybe once or twice for a story, to talk about some of the work that we were doing, and I know that when I call you about something, that it's going to be portrayed reliably, and it's and that's really important, that the journalism is really focused on communities, especially for the work that you do and the work that we do here at Protect PT. So I want to thank you for that, and for writing this book. And we're going to talk about it in June and have you here. And also join us next month, the day before our talk with Kristina on the 27th. We're going to have another Lunch and Learn. We're ready to book our guest for that meeting. And please join us on the 28th for the book discussion with Kristina, and tell us what you think about our Lunch and Learn by doing the survey. Thanks everybody for watching today. Thank you so much, Kristina, for the work you do and for joining us today. And have a great afternoon, everybody. Bye.
Thank you so much, Jillian. Thanks,
Thank you.
everybody. Bye.
Bye.